Now with a report on eyelid surgery. Here's our reporter, Laura Windsor.
Roger, we traveled to Fort Myers to talk to plastic surgeon Dr. Robert Brueck, who explains why people consider having eyelid surgery. But as we'll find out, there is a medical reason.
When I look at people and I look at their face, the majority of our bodies, most of the time, is covered by our clothes. But the one part that isn't is our face. And I often will tell patients, if there's one procedure that I think for most people, and I'm talking probably 60, 70, 80% of people, that will do the most to turn back that clock, those hands of time, would be to do an upper lid blepharoplasty, or what we call an eyelid lift. And the interesting about this is, not only is there a cosmetic benefit, there's also a medical benefit. And one of the conditions many people suffer from as they get older is hooding. In other words, it's like the bill of a baseball cap. So as the skin on the upper eyelid descends, it creates hooding over the eyes. So that means their upper field of vision is diminished. And that prevents them from having a normal field of vision. So when we do an upper lid bleph, not only do we improve their vision, we also improve the way they look. So it's one of those procedures that has a double benefit.
Who is a candidate for eyelid surgery?
There's really no ideal candidate for blepharoplasty. But if we were to categorize candidates, there are two categories. Number one is the younger individual, male or female, who just wants to look more youthful. It might be somebody that's 40, 45, lost their job, and they're looking for that little edge physically to look a little younger, a little more dynamic, a little more youthful. It's not really impeding their vision. It's not impairing their vision. So there's that segment. Then you have the other segment that are 65, 70, 75, where it actually is a physical impediment to their seeing. Many people, before coming in to see me, may have seen their optician, optometrist, ophthalmologist, and they do what we call a visual field, where they put their head into a box or cylinder, and then little twinkle lights come around. Okay, and that maps out your field of vision. Then what they do is they take your eyelid to simulate a blepharoplasty, and they take that excess skin and tape it up. Then they do the same field of vision. So without taping, this might be your field of vision. When they tape it up, your field of vision might be like this. So it's important from the standpoint of seeing objects above, and the main example is traffic lights. Years ago, and I'm dating myself, in the 40s and 50s, they were on the side of the road, and you had the red, green, and yellow. And now they're overhead, over the middle of the road. And so that superior field of vision is critical, especially for older people who maybe don't have the reflexes the way somebody that's 30, 35, 40 does. So they have to be extra cautious, extra careful. And doing a blepharoplasty for them actually improves their ability to see physically.
Eyes are the first thing most people look at when meeting, making these procedures very helpful for a younger appearance. For the American Health Journal, I'm Laura Windsor.